Welcome to the She Self Cares Collective podcast. All right, and welcome again to another episode with our Triple E, or we call it She Self Cares Collective, where we bring all women and we have this amazing conversation to really encourage, educate, and equip women to prioritize themselves and thrive. And I'm so excited, as always, to have an amazing guest on today, Dr. Leila Sadien. And she wears many hats. And I'm going to read a quick bio of her and then we'll get started. So, Dr. Leila Sadien is a visionary medicine woman. I love that. She's a shaman and sacred leadership guide whose work bridge embodies wisdom, integrative medicine, and transformative breathwork practices. With deep roots in somatic initiation, Western medicine, I love that, and holistic healing, she brings and empowers individuals to embody their highest potential, guiding them towards authentic, holistic alignment and purposeful living. What a great job. Welcome, Dr. Leila Sadien. Thank you so much for joining us today.
Thank you, sister. Thank you. And it's such a great job. I love that you said that. It's a great job. Yes. Thank you for having me.
It's amazing. So let's start with this. I always start with, these questions and saying, let's forget about the title and who all this is, and just kind of really to rewind and say, who is Leila before all these titles, all this, who is she? What is the essence of Leila?
It's an age-old question I think I ask myself every single day. Just coming back to the authenticity and the essence here, because the titles don't maketh man in the end, right? Yeah, who is Leila? I guess if we go back in time, I remember being a young colored girl in Cape Town, and my memories are of concrete and dark rooms and noisy neighbors, and just growing up in a way that was so uninspired, other than profound emotional trauma, other than trying to navigate being a little girl who was super sensory in a world that didn't understand that or know how to nurture that. Yeah. And then most importantly, growing up and just feeling like I didn't belong anywhere ever, and constantly trying to understand how is it that everybody else seems to be so human, and what do I need to do, and how do I need to fit in? And so I guess that in all of that, and again, this is retrospective, I realized that I was a very kind person. I was a very loving, I was a kind human being, and I really, I don't enough, and I don't think any of us enough give ourselves a pat on the back for that inherent nature of our being, but life was not easy.
Yeah. It's never perfect, but it's worth living, right? It's the experiences all these experiences that make us who we are today and who you are today. And you're able to empathize, I guess, with people that might be going through where they don't know how they feel anyway, especially in your field as well. So I think it's always, like I said, in hindsight, it's always great. It's always interesting how your path is your path. And you go through what you go through and because of what you're meant to be.
Oh, yeah, absolutely. And just the same way that we don't want our titles to define us, that the things that happened later don't also have to completely define us. And we don't often ask the question, who was I at my essence? And I'm really grateful to you for that. And hope that the listeners also had a moment sometimes to think about who was I at my essence before all the things happened.
Absolutely, absolutely. So now let's go into what you do. You're both a trained medical doctor and a shaman, which is two words apart. As well, we say two words apart now, but they're not supposed to, because holistically, this is supposed to be how medicine should be practiced anyway. But
Actually.
we've known it to be a word apart. So can you tell us how this part of your journey came together?
Yeah, isn't it strange? It's exactly what the healer was always meant to be. And at some point it got separated from consciousness completely, how interesting. So how my worlds came together, other than just feeling like it was gravity and I couldn't fight against it. Other than that, um, as I said, a big part of fitting in and trying to belong to this world meant being validated by the world. And
Mhm.
the way that the world validated a young woman who was doing well at school was
Mhm.
go study medicine, right? And I remember how happy my grandmother was. And my father was so, everyone was just like, yes, this is success. You've done it finally for all of us. And struggled through medical school. I struggled, BC. I did not enjoy what I was being taught. I didn't enjoy the way that I was being taught it. This kind of parrot fashion didactic shoving down your throat and then just leaving you to go and like study, but not to study what you wanted to study what they wanted you to study.
Absolutely, absolutely. And the way they want you to do it, not the way
The
you,
way,
right?
totally, and answer it the way I want you to answer it. And
Mm.
so the academic aspect of medicine was hard. I mean, I loved when we were doing science and we were doing chemistry, like I loved that. But when it became medicine, it didn't feel very aligned to the way that I wanted to understand the human body. And then later, as we moved into clinical practice, very excited. Oh, yes, this is it. We're going to go and meet people now. The healing happens, and then understand that so much of the paradigm is, in fact, to create a giant obstacle against healing.
Mhm.
And all the things that was natural to me, listening to the person's story, going to sit on their bed, like holding their hand, you would be failed in an exam if you did any of those things. Right? It was like
So true.
demonic.
That is
Right? You're like sharing bags. I wanted to go and pick up the children in the ward, and I wasn't allowed to do that either. And so I really was a resistant med school student. But I am very grateful for the foundation that it gave me in creating a professional way of engaging with clients, number one. And of course, the knowledge that I understood about anatomy and disease. I think the next thing that hit me was when I opened a GP practice and realized that 90% of the stuff that I was seeing was never taught at med school. Like in normal family practice, people are coming with like syndromes and a kind of a headache, and it's not really. And my brain was going, I'm trying to find the disease. I'm trying to find the disease. You
what
know?
is differential diagnosis and all this. What is going on here?
Yes, totally. Why are these people so complicated? They just give me simple symptoms and I can give them a
No.
drug. Yeah. And then I understood that in order to be in family practice, I was going to have to teach myself. And this is why I always say, that a GP that is experienced is such a magical tool in the world, because actually intuitively they've worked it out, how to become a healer in that space beyond what medicine taught them, despite what medicine taught them. So that was medicine for me. And I think when I worked in the hospitals, when I worked in some of Cape Town's, or in fact, I worked in Baragwanath for the longest time, which is in Soweto. And I saw the horror that was unfolding in terms of how we were supposed to be caring for patients. I think I really became very disillusioned about the system.
Mm.
Um, and then I had cluster headaches. So from the age of 19, which was my entire medical school career, I suffered with suicidal cluster headache pain that medicine didn't have an answer for. And
Yeah.
the solutions that medicine gave was I could buy a sumatriptan injection, which was it was 500 rand at the time per,
Mm.
and I was
Wow.
having 30 headaches in a month, and there
Wow.
was no way. So I'd have
Wow.
like three on a student budget, and
Yeah.
then have to like choose like when is the moment that I can take this pain away.
Wow.
So that was an interesting time for me, and I had to begin to explore more. I had to explore beyond what Western medicine could offer. So Chinese medicine found relief in some way, homeopathy found relief in some way. And then I began to go, okay, well, there's obviously truth in all of this because how else am I getting better? And at the same time, something about this makes my soul sing when I
Mm.
when I hear the words of like understanding the elements in my body, like my soul comes alive, you know, when I hear someone talking about this particular plant works because it looks like your heart, and therefore I was like, oh my God, this is like this made my soul sing. So at the same time that I was practicing medicine, I studied Reiki and homeopathy. Um, for both of them, not to become a practitioner, but because my soul was singing when I was sitting in those spaces, you know. And then the journey continued. Again, I was exploring all kinds of healing as a personal journey of trying to cure my cluster headaches. Um,
Mm.
and when I began to share what I was learning with my patients, I was noticing that they were also having their souls lit up. And then I studied integrative medicine, which was beautiful because it brought functional medicine into the conversation. So we were looking at the physiology of how the body works, and being able to treat with natural medicines because, you know, we're deficient in this or we're needing this herb to bring this adaptogen, whatever. And then integrative medicine, which was starting to bring together the worlds of spirit, and energy and quantum with all of that. Um, and then paralleled as a third journey, I was going through my shamanic initiation. So it
Wow.
was inevitable in the end. Yeah. In the end, it was inevitable.
Oh wow. Oh wow. That is that. I mean, as a physician myself, and especially if you kind of grew up in the Western world, you almost want to believe that that's the only way. And sometimes you often also want to believe that because I have spent so much time learning. I mean, you can't tell me after 10 years of learning, I don't know what I'm doing. Come on.
Totally.
So it's like, we often also get into that almost, I feel like a lot of a practitioner get a bit defensive when it comes to this holistic, and also, especially if you don't I wouldn't say you don't want to study more, but you get busy and you do what you do, right? And you don't
Yeah.
get into, maybe you don't have, you're not as curious about let's see what Chinese medicine says. Let's see whatever. And then we often get this defensive about it sometimes. They're like, yeah, whatever. Well, just be careful what they give you. And then people, they kind of and they kind of separate, like it makes a patient or patients or people kind of almost question if it's real or not, right?
Yeah. Yeah. And
Real.
that's its intention, isn't it? I mean, that was
Yeah.
the whole thing that the system did when it invented the concept of medicine in a university in the first place. It burnt all the witches at the same
Yeah,
time. You know?
absolutely. Absolutely.
Yeah.
Absolutely. You're right. Absolutely. Absolutely. Yeah, absolutely. And that's what we've seen. But what does that mean today when it says, in shamans in this work today? How does this differentiate or different for what most people assume? Because when people think about shaman or shamanic practices, you often again think, oh my God, witchcraft, you know.
Yeah, yeah, of course. And they're gonna make you give you drugs and you're gonna be high and you're gonna
Or you like woo woo, you
vomit.
turn
Yeah.
into this woo 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 kind of
Yeah.
person.
Yeah. And
What
to be
exactly
fair,
does that mean to this
some of
work?
that may actually happen, to be
Right,
fair.
because
You know,
again,
somebody
when your
said,
soul is open, right, you can go into woo woo. I get it. I get that part. When you're really connected, you don't even know how you react. When your body, mind, soul, everything is connected. I can't even imagine how you feel being
yeah,
in that realm, right? So I can also see why they will say it's woo woo and all that.
yeah.
But what does that mean in today's world in terms of a shaman in this today's world in medicine? What does that mean?
Yeah, yeah. It's an interesting conversation that makes me think for a second first about value.
Mm,
And in today's world, um, how much illusion there is around value, you know?
mm, mm,
And we don't even stop to question it. So someone will pay a medical doctor a particular amount of money,
mm,
and you and I both know what we do with just pure medicine, you can quickly squeeze into 20 minutes. And that's, if you're doing it for an hour, you're really stretching things. You're maybe going to do some tests or, whatever. But there is very little actual healing that happens in the time you spend with your doctor. And then, of course, they give you a prescription and a thing for whatever you need to do for your body afterwards, right? Time spent with a shaman is every second is transformative. Every
mm,
second is transform. And when I say transformative, it is at a soul level, at a deeply integrated soul level. It isn't a coach. So it isn't someone there giving you guidance and advice. It
mm,
isn't a therapist. It's not someone there listening to your problems. It is someone who is going to meet you in your darkest places. And when I say dark, I mean the places that you are not able to go with your mind.
mm,
Like that is invaluable. That you can be taken out of all the because we're very clever. We know everything about our lives. We know our family traumas. Like we know our limitations. We know it's the capacity to take you beyond that into the places you don't know and meet you with deep intimacy and compassion and love in
mm.
that space as you navigate together a new perspective. You know. Um,
Absolutely.
So the value of being able to do that, like it's priceless in the end, and yet we have to try and justify it consistently. We have to try and, well, here's a certificate, I studied this, or yeah, like this is the lineage that like, and yet we as human beings, I don't think we've caught up to true value yet.
Mm,
Um, so so yeah, I mean, to be in a shamanic practice where the person is also a medical doctor means that we take your experience of symptomatology or dis-ease or even disease, and we drop into the ultimate root cause, which is always going to be on a quantum level. And not only are we able to feel the energetic shift that ultimately caused the physical shift, but also able to kind of go into what are the multi-dimensional, sensory experiences that are consistently impacting this human being so that this disease is not able to fall away.
mm. I'm going
For
to let you pause.
example,
I'm going to let you pause on that real quick.
mm,
Yeah. Oh, I know we said let's take a pause, but really what I wanted to also kind of get into as you continue this amazing conversation, especially when we're talking about what does it feel like in today's world. While you're talking about that, I would also like you to kind of also explain or walk us through what a session might be like for
mm,
someone new to this
mm,
kind of healing and practice.
yeah, yeah. So I can only speak from my own practice. Because again, when we don't have an institute or a university unifying the way that everybody presents something, it's very unique from practitioner to practitioner. So in my own practice, when a client arrives, they will have already completed a very comprehensive intake form that touches on all of the aspects that I am potentially able to provide a platform for transformation within. And so when they arrive, they've actually already considered their lives very deeply and holistically, despite whatever their small complaint may be. And once I sit with them, there is an energetic, unconscious weave that begins to unfold where we're merging, we're becoming one so that I can fully drop all of the limitations that are within me to be able to feel their story. And the client feels that. So by the time that they begin to speak, and if their nervous system is if their nervous system is creating a sense of anxiety or disruption and they aren't aligned, then we will start with a little practice to bring them to that place. And then once they begin to speak, they're already so connected with themselves, and there is already a sense of trust that they speak from the heart, not from the mind. And that is an essential step in the therapeutic process. Because if we're having conversations from this space, then, what are we healing? you know. So once we're dropped into a heart resonance, we can have a heart-led session. And in that space, I have to be just fully present and listening to not only what is moving through the client's conversation, but what is also moving through their physical body. And so I can feel when the body is starting to tell me something that is beyond what the client is saying. And I'll stop them and we'll come back and I'll say, I hear you, just pause that for a minute. But when you say that your body doesn't feel very good, can we go deeper into that? Yeah. At the same time, sister, I'm also attuned and listening to their guides or the beings that are in their field. This may be a grandmother, it may be an unborn child, it may be angelic, whatever that frequency is. We're all guided all the time, and we all have support, and we don't ever walk alone. And so when someone arrives, they bring those beings in with them, and the beings are aware that there is a space where they can be heard. And so they're communicating in a very lucid, integrated way. They're not just shouting in the background, they're kind of like dancing with the consult. And that allows me to bring the client to a very deep level of understanding of self. And when we reach that sense of, actually, this is who I am, the conversation can drop into a place where perspective is shifted completely. And we can look at the problem from a very different place. And then, really, depending on what is required, it can go into all kinds of things. It may simply be a conversation around this physical vessel is not able to hold the frequency of light that is moving through you. And so what do we need to do to upgrade the physical vessel? And then it becomes like a more traditional medical consultation, specifically an integrative medical consultation. We understand, we work with the different systems. Is it your adrenal glands? Is it your gut? What do we need to do to bring them into alignment? Or it may go into more deeper shamanic practices, like what we understand to be soul retrieval or cord cutting, or engaging with entity energies in the field. It really just depends on what the client needs.
That sounds really, it sounds, I'm trying to get the right word for it. It sounds very, I still can't find the right word, but it sounds so deep. Like it sounds like, because I'm a healthcare practitioner. I understand, the integrative part of it, but you're going a bit deeper in terms of you having a session with someone. And not only are they there to say, okay, maybe I'm having this, I don't know, I just say abdominal issues that I've been having, whatever, but I want to go deeper into why I'm having it. And a traditional doctor would just say, tell me your symptoms, how many times you use the bathroom, what's your meal like?
Yeah.
And then you're talking and talking, they're like, hurry you up. Like, listen, I know what I'm talking about. Just answer my question. How many
Yeah.
times you poop? How many? And you're like, okay. But this sounds so, oh God, I still can't find it right, but it's so spiritual and so deep and
It's
soulful.
sacred.
It's sacred. Okay, yes, it's
Yeah.
sacred to that I'm having this conversation about what is going on with me, but I'm having different levels of experiences while I'm also trying to explain what is wrong with me.
Yeah, absolutely. And a simple example of something like abdominal pain is like, let's go into the pain. And then because I am able to, I have a clairsentience, which I think is common for every medicine woman. I can feel what they're saying. And so now I'm going into the experiential process of the pain. And then it becomes so much more than just make the pain go away. Instead, it's help me to understand this pain. What is my body trying to tell me through the pain? And babe, I mean, usually, it takes us into, sometimes it's into the womb, it's like, it's ancient stories that the mind would not never have known itself.
Absolutely, absolutely. And no wonder traditional medicine sometimes can be frustrating for people. Because imagine you being seeing a shaman that's also an integrative medicine, and you go in and you have this experience, and now you go to a traditional doctor. So you mess it up for me. So you go to a traditional doctor and you're saying, oh, okay, and I'm telling you, try this medication. We'll try it for 7 days. Let's see if it works. And you're like rolling your eyes, like, listen, I've tried many medications before. You don't know what you're talking about because my other doctor told me it's coming from my bladder. And you're like, bladder? And it's like, it's so confusing. So I can imagine
Yeah,
a patient, a client living with something more deeper than, even if I don't have the solution right now, I'm
exactly.
comfortable enough to say, oh, I'm willing to go deeper to find the root of it. I'm willing
This is it.
to go to the process of the healing process, not
This is
just,
it.
not just medic antibiotics for 7 days. Let's see what
I could
happens.
go away. Yes.
Right.
This is fundamentally the difference in the paradigm, really. It's I don't feel good. I want to feel good again.
Mm,
This doesn't feel nice. Make it go away. And that's how we lived, right? I have a pain. Give me a painkiller. Simple, right? I had palpitations. I don't want to have them anymore because I don't want to die, in the end.
right, right.
And I think the filter that we go into with a conscious medicine practice like this is how wonderful your body has something to say. What is the soul trying to communicate through this? Because in the end, the soul is everlasting, and the soul will happily sacrifice its life in
Mhm.
order to teach it a lesson at a soul level. And we think about cancer patients so often, like the body happily will make a cancer if the cancer will teach your spirit and your soul how to evolve. And so when we can respect that and navigate that, and then at the same time respect each other, because I send my patients to the doctor. I'm like, babe, I get it. You need an antidepressant. Like, you're not going to get through the day. Go see a psychiatrist. And then, unfortunately, it's rare that the person on the other side is happy to work with me, but I am very happy to work with them, or while the cancer patient is moving through their chemo and doing their surgery and everything else, let's also go to the root cause and work together, you know.
I love that. I love that. I mean, I'm getting transformed right now just having this conversation. So I hope as many listeners will get a bit of transformation and understanding the value. And I think you mentioned earlier the value that this brings to the table. And also we opening up our minds to the unknown, because that's usually often the fear, oftentimes. But let's talk about some common misconception and that people have when it comes to this and fear about working with a shaman. And how do you gently shift that perspective for them, for anyone
Yeah.
that might be listening?
Yeah, absolutely. And I think I've also had to shift my own understanding in this piece that is, you can only be medicine for certain people.
Mm,
And as a doctor, that wasn't even hinted at.
mm,
It's like if you're the doctor in that area, you're the GP for that area, and everybody must come to you, right? But you as a being, when you understand that you are the medicine, and this is not exclusive to being shaman, like this is true for every being on this planet. You are the channel of light in your own unique way. You have the potential to be the healer in every realm of your existence. Um, you can't be medicine for everyone, right?
Yep, yep, absolutely.
And in our attempt to reach many people, we compromise ourselves sometimes. And then we think, what do I need to become for many people to want me? As opposed to how can I be more of me so that the right people can see me or know me. Also coming out of the theme of wanting to be seen and into being known, you know. So I have had to navigate at many levels this concept of being digestible and acceptable.
Mm,
And I have, as many pioneers have had to do, been demonized in so many ways. And I say that with a smile because I know I'm doing the right thing. You know, I know that I'm changing the old pattern because the people who are beholden to the old pattern are going to not like it. So it hasn't been easy. It isn't easy, you know, and hearing the stories. I mean, yesterday I heard someone talking about, oh, you can't see Dr. Leila because she's was drinking whiskey and smoking at a mushroom ceremony. I'm like, I'm allergic to alcohol. I would have a cluster headache in a second. If I chose a drink, it would definitely not be whiskey of all the things. And I am completely allergic to cigarette smoke. I can't even be within like 3 kilometers of someone who's smoking a cigarette. And yet, that is now a truth in the world that somebody felt was an appropriate lie to demonize something that they felt they didn't understand or didn't agree with, or, you know. So this is the world we live in. It is certainly the world that I live in. And so it does become important that I share what I do in a digestible way without compromising the potency of what I do, you know. So one of the questions that I think we discussed asking around, what is my consultation practice? What does my practice look like? You know, and I was sitting with this, like, should I mention this or should I? Because the very first thing you see when you come in is this big Cape Cobra portrait that I have on the wall. And I have it because one of my really best friends is the photographer, and she just takes the most incredible photographs of animals. But the archetype of a serpent and the concept of birth and rebirth and shedding skin and has been a ally in my life, you know. And yet someone else will walk in and go, "Oh my God, there's snakes on the walls. It must be witch," you know. It
go
can
again.
it's so difficult. It's so difficult. You know, I have a dragon tattoo on my arm. Like half the world is going to say one thing, the other half is going to say the other. Um, so my love, I'm navigating that, and I think we all are. You know, I think we all are. How do we be digestible without compromising truth?
I love that. I really love that. And I think that kind of translates to, like you said, to everyone and to all our lives in different aspects of all our lives, whether as a physician, as a mom, as a woman, as some, whatever, it's very relevant because there's always going to be an interpretation or perspective of what someone would think of you
Yes.
regarding how nice or how mean you could be, right? And it's a matter of you finding who you are and letting people and figuring out me, myself, my whole being, rather than, you know, and being authentic about it and showing people what that is, rather than trying again, like you said, rather than compromising and saying that's what they want now. The world wants someone that speaks like this, that have this whatever it is in their office, you know. Maybe if I go in with a Picasso picture, that's what is going to attract them, you know what I'm saying?
100%.
That translates to everything. And I think that's the important of what you do in terms of really approaching everything in an holistic and a being soulful way that connects everything together, because you
Yeah,
cannot deal with the body without the mind. You cannot deal with the mind without the soul. Everything has to be addressed as one. And that's what,
absolutely.
means, but
You
let's
know,
talk
it's
about,
I just want to share that it's a funny thing that when I started this, I would have never imagined that this would be a reality. You know, this person and what I would never have imagined that could be possible.
Oh.
And like I realize as I'm speaking, you know, some people call me a disruptor as my archetype, that my
Mm,
intention is not let me come in and change this world. I think as I'm saying this, a big part of my intention is this is who I am, and the world is not ready for that.
mm,
Uh, what do I need to shift in the world to accept who I am?
mm. Not for the world not for the world, not for you to accept what the world says about who you are, but
No,
who are
exactly.
right, right.
Uh-huh, exactly. And only through my conception of my own value can I change the perception of what value means. And then through that, I'm changing the world, you know? But it's
Mm.
this constant, like, you have to commit to yourself, even if yourself is not giving you evidence that it's going to be successful.
That's deep.
Mm,
That's deep.
mm,
I love it.
mm.
I'm really enjoying this conversation. Absolutely love it. But let's kind of digress a little bit and talk about the soul, systemic healing in terms of, you often speak about embodied wisdom and sacred leadership. Um, what does that mean for everyday women trying to navigate their life, their healing and purpose? Because we are putting everything together, and because, of course, because this platform is also for women, we got to be
Yeah.
more specific for them and
Yes.
the
Yeah.
nature. So how does this mean for everyday women when we talk about embodied wisdom and this sacred leadership that you talk about?
So I teach a course called the Multisensory Medicine Woman course. And the first thing to kind of get over is that most of the people who arrive are just women. You know,
Mm,
they're not shamanic, they're not practitioners of anything. They're just women and they're wanting to learn self-mastery. And
mm,
when I say medicine woman, what I'm really saying is, can we come back to embodiment of the fact that we are the medicine, and then also become intentional about the way that we weave that in the world, not in our 9 to 5. Some of
right.
them, you know, that most of their medicine is actually practiced outside of their job. And how do we then learn to integrate that space? Because even if you are, again, I'm using the examples of an architect, but if you're building a building, how is your building medicine? How is it contributing to the upliftment of the frequency of the planet and the people? And you can feel how the world shifts when we do that. So, somebody, for example, is an attorney, right? And she's a lawyer, and that's what she does, and she works with family law. Now that she has integrated her medicine woman, embodied what she is as a medicine woman, her
Mm,
practice has shifted. So when people come and see her, they're healed in the process. How often does that happen with the attorney? And how badly do we need healing when we go see our attorney? You know, like we're in the worst trauma, we're terrified. And the attorney's just doing what she was taught at law school. So
mm,
it's that really, you know, it's like it's for everybody. We all have this capacity, some more ready than others, some who have had lifetimes of practice and just need to be reminded of who they are. Others who may be newer and need to learn a little bit more, but everyone is at a different level, but we all have the capacity. And as women in this time, it is our duty to reset what the world understands as sacred and spiritual, because it is the realm of the feminine in the end. And hasn't that just been ripped away from us, you know?
absolutely. I love that. You're just speaking some words, some life today. I love it.
Thank you for asking them. I appreciate it so much. Thank you.
And then how can we now begin to listen to our bodies intentionally and
Yeah.
recognizing when it's calling us for a deeper healing?
Yeah.
How do we even begin that process? Because we're talking about it now and it sounds amazing, but I'm sure there's a lot of people that will be listening and say, how do I even begin this process? Right?
So I think the first thing as I'm feeling your question is how much we we're living from a distressed nervous system,
Mm.
and when we're in what we understand as fight or flight or drop and freeze, whatever it is, when we're in that state, you can't listen. It's not safe to listen.
Yeah.
Like, right, you're in survival. So the body's going like, "Oh, I'm sure, and I don't know, I didn't pay the bills, and I did, and all of this energy, like to just stop and go, oh, what is my abdomen saying to me is really hard. It's really hard. So for the majority of humans, there is this bridge that we have to first cross, which is honoring the nervous system, you know.
Mm.
Um, are there supplements that we need to take? Is there exercise that we need to do? Like, what do we need to do to first get to this place so we can bring our nervous system into alignment most of the time? Because obviously, fight or flight is part of life. Um, but where your sympathetic tone, or rather your parasympathetic tone, is that state of being calm more often than not
Mm.
and being present more often than not. And then from there, it starts to become possible to listen, to
Yeah.
truly listen, to intimately listen. Um, yeah, so definitely, that as a first bridge is, where is my nervous system? And then I think going deeper into listening to the body, again, we've been conditioned to escape pain. The minute that there's pain, what do I do to get away from that pain?
Mm.
And listening to the body is exactly the opposite direction. It's the opposite direction that we've been taught to go. And how do I become the pain? And I got taught this by cluster headache, where it was like, babe, you're not going to escape this. It's not going to happen. For the next hour, you're going to feel this. And whether it takes you into the depths of hell, it's not going to kill you. So what are we going to do? And then I had to go into it, and then I had to kind of become it. And that was really the only way that I could cure that disease, was really embracing it and becoming intimate with it. And then understanding that it was me, it was an aspect of me that was asking for a voice. And that's the truth about pain in our bodies. It's an aspect of self that's asking for a voice. This is the way it knows how to speak. And when we can meet it with love, as opposed to this, like, okay, well, when I find it, then am I going to take the hammer and knock it over the head? What am I going to do when I find it? Um, you're just
Wow.
going to love. That's
Yeah.
all.
I love that. I mean, I always say it's, we have to learn to sit in our funk, and which is our
Mm,
pain, our funk, because like you
mm,
said, we just want to escape it so badly. And I love that you said that's how you actually find yourself, because yourself is calling you, and it will do it no matter what, however it's gonna get you, because that's how we are created. That's how we are, that's the being. And so if you're disconnected from your being, it's gonna call, however it's
okay.
gonna call. And we often run away from that pain and from that uncomfortableness, for that really, because sometimes even with shift in our lives, we feel that urge and something is off. And I found myself like, if I'm not really listening, that's when I'm like turning the TV off. But I know it's not the TV that's gonna. I'm turning the TV on to watch something, but my soul is saying no. I just want to be. But we live in this world that we know how to distract ourselves. And
Yeah.
but there's always the urge, there's always something that is calling us. It's calling us, right? And pain is one of those things. And I love that you said that, and being and staying with it, and being that pain, embody the pain, so you understand why and what and how, to become one in itself. Woo!
Yeah. And it seems hard, I mean, I'm hearing you saying it and I'm like, fuck, sorry, excuse the language. Um, 10 years ago, if you had said that to me while I was in the middle of a cluster headache pain, I'd knock you out.
Absolutely.
But in my experience of doing it myself and working with my clients, there is a threshold that you finally meet when you understand the value again. When the value lands, it's like, okay, there is something that is productive, and it adds to the purpose of my being if I do this. It changes everything.
Love it. I love it. As we round up, I'm going to ask you this. What's one thing about your work or journey that surprises people the most when they hear it?
Hmm. Hmm. Surprises people the most. I would say not my journey specifically, but I would say that people are very surprised at their own power.
Mm,
I'm kind of tapping into the frequency of surprise, and in a consult, that's where the surprise lands. It's not often in what I do, but more in that they didn't know how powerful they were. They didn't know that what they understood to be pathology was actually their power, but without training and nurturing. Um, so most of the women so part of the questionnaire will say, do you ever feel anxious? Scale this from 0 to 10. Do you ever feel depressed? Scale this, and almost everybody has got something going on there. And when we really drop into the feeling and what that is about, it is very clear that it's because they are this divergent being, this atypical, non-normal being, trying to fit into the box of the matrix that is expecting them to be normal in a particular way. Um, and when they see it, and I can track them back to moments in their lives, so often their guides will show me that time at that age, show them when they could do that, remind them when they could do this. Um, it embodies, and then they can't escape it ever again.
mm, I love that. I love that. Just finding yourself and it's always been there. Like you said, it's always been there. It's not something I always say it's not something you discover rediscover or something. It's always that something that you have to rediscover because it's always been there. It's just a matter of tapping into it and finding it. I love that. I
Yeah.
so I will ask you this.
Mhm.
If your inner healer or shaman could whisper one truth to every woman listening here today, right now, what would she say?
Mm. She would say, rise. It is your nature to rise. And despite how the world may choose to crucify that or demonize that, the higher you rise, the more your light can impact everyone else in this time that we are in. It will not serve you, it will not serve anyone else to stay small in this time.
Mm, I love it. I love it. I love it because we're created for greatness anyway. And it's our birthright. It's our birthright to
Let it
live,
out.
right? To live our optimal best and optimal life and to be all,
Mm,
right? To
mm.
really experience what we're here. We're here to experience, right? Because
Yeah,
we that's
yeah,
that I love that. I love that.
yeah.
It has been an honor talking
Mhm.
to you. I know you mentioned your multisensory medicine women course that you're currently offering. If anyone is interested, how can they get into this amazing? Because this is amazing. I mean, I feel like we've had a healing process for the past hour, and so I can imagine
Thank you,
what
Bece.
this will be. So, if anyone is interested, how do they get into this program and this course, and how do they get in touch with you as well?
Thank you. So my website is probably the easiest access point, drleilasadien.com. But they can book a discovery call, and I'm happy to just have, just a heart to heart and see where they're at and if what I am offering is able to serve their journey.
Absolutely. Thank you so much, Dr. Leila. This has been amazing. We are honored to have your voice as part of our She Self-Care Collectives.
Thank you for what
Thank
you're
you for sharing
doing.
your journey, your wisdom, and your light with our community. Thank you. We always say this at the end of all our conversation. The 3 E's is to encourage, educate, and equip. And you've come and you've checked all those 3 boxes. You've encouraged us, you've educated us, and you've equipped us today with tools that we can now add to our toolbox to protect
Amen.
ourselves and thrive. So thank you so much.
Thank
Gratitude.
you. Thank you, Bece. Thank you for what you are doing. And may your light also just resonate just louder and louder and louder. Thank you.
Thank you so much. Thank you guys so much for joining again, and we'll see you next time. Thank you so much for tuning in to another episode of the She Self Care Podcast. If you enjoyed today's episode, be sure to subscribe, share it with a friend, and leave a review to help others find us. Remember, self-care is a journey, not a destination, and you deserve every moment of it. Until next time, keep shining and taking care of yourself, body, mind, and soul. You've got this.